Hello! In this video, I'm going to be talking about breast reconstruction. What is it? Who should consider breast reconstruction? How to choose a surgeon? And the different types of plastic surgery available. Breast reconstruction is a type of surgery done that's separate from removal of the tumor, but often done at the same time. If you are having a mastectomy, removal of the breast, or a larger surgery that's not quite a mastectomy but removes a fair portion of the breast, you may want to consider breast reconstruction. Breast reconstruction is the procedure done to recreate the breast mound after removal of the breast. So we don't actually build a new breast, but we create a mound that looks like a breast in terms of its shape and size. There are lots of people who have a mastectomy and do not want to have breast reconstruction. That's okay. You are still a beautiful person without having a breast mound. Some people feel pressured to have breast reconstruction. And again, this is a personal choice. Now, one of the hardest things about having breast cancer is the effect it has on the way your body looks and your body image. And there's a lot of evidence that having your breast reconstructed can help restore your body image by giving you back a breast mound. A lot of my patients have told me, I can't imagine not having a breast. I don't want to have a prosthesis, which is a way of putting a form in your breast, in your bra, so it looks like you have a breast. But for lots of women, waking up from surgery or knowing that they will have a breast eventually over the next few months or the course of a year, that's super important to them. Again, it's not for everybody. I hope I haven't belabored that point, but I've heard from patients, people being pressured to have breast reconstruction or not even being told that they can. All right, so how do we decide? This is a decision that you should make based on your preferences, what you want for yourself, and also in conjunction with your medical team. However, before you have breast reconstruction, you will see a special type of surgeon called a plastic surgeon. There are even plastic surgeons who specialize in breast reconstruction. And I would recommend asking your medical team who they would recommend. Who have they worked with? Who their patients like? Who they've seen the best outcomes with in terms of how the breast looks? When you go to see a plastic surgeon, expect to be shown photographs. This can be somewhat surprising. Seeing photographs of other people who've had surgery is something not every person is prepared for. And so you should ask, will I be seeing pictures? Can you show me pictures? Can I even talk to your other patients? These are all things that my patients have taught me are really helpful. It's worthwhile bringing somebody with you to a plastic surgery appointment. That doesn't have to be your partner. It can be a good friend or a patient navigator. When you are deciding what type of reconstruction to have, know that this is also your choice. There are two main types of plastic surgery. One is implant reconstruction, and the other is called tissue reconstruction. Now, some people will have both. I'm going to start with implant reconstruction. Implant reconstruction is where you have an implant or a prosthesis placed under the skin that looks like a breast. And this can be done in two ways. One is placement of an expander, and this is just a saline sort of form that's not inflated at the time the surgery is done. So a prosthesis is put in, an expander, is put in that will then be inflated slowly with saline to help expand or stretch the skin. The other kind is to have the prosthesis put in right at the time of surgery. If you are slim or don't have a lot of tissue, you will need an expander. What's that for? That's to create a pocket where then the prosthesis can just be placed. So the expander comes out and the prosthesis goes in that nice pocket created by the gradual stretching of your skin. Your team can help you learn how to manage any symptoms you get with expansion of the tissue. Now, a prosthesis, there are two types of prostheses. The first is a saline implant, and the other is a silicone implant. People have a lot of concern about silicone. We actually know that, except for in very rare cases where the implant is textured, that there is not additional risk to having silicone implanted. You'll learn more about what these types of implants feel like when you talk with the team. Both types are reasonable and represent good care. Now I'm going to talk about tissue reconstruction. And as I mentioned, some people also get an implant as well as tissue. Tissue reconstruction is when the team takes tissue from your body, several different places. The most common is from your stomach. We all have a little extra tissue in our stomach, except for some people who don't have enough. In that case, or if you've had other surgery on your abdomen, we will use tissue from a couple other places. We can use tissue from your back. That's called a latissimus dorsi flap. We can also use tissue from the gluteus area, which is your butt. If they take tissue from your backside, they will often do surgery on the other side so you have some symmetry. Some of my patients have told me that they like this because they get what's called a butt lift when this is done. Having a latissimus flap from your back is not something people usually prefer because it can make you a little weaker, but for some folks who are very slim, that's your only choice. Now, if we want the breast mound to be larger, you can have both tissue moved to the area where the breast is, and then also an implant. And the purpose is to try to give you symmetry between the two breasts. We do not recommend that both breasts be removed unless you are exceptionally high risk of having breast cancer in the other breast. I've covered a lot. I've covered the different types of reconstruction. I've covered the different types of expanders and implants and prostheses you can have. I've also made it clear that this is your choice. There are two extremes, people who feel they're pressured to have reconstruction and people who aren't even told that this is an option for them. So make sure this is part of your decision-making treatment plan conversations with your team. If this video has been helpful for you, click like. That will help other folks find the video. And subscribe to our channel to learn more about other treatment options. And don't forget, you can visit Yerbba.com to get even more personalized information just for you.